Hi, everyone. I'm Dr. Samantha, and I'm the maternity mentor. Welcome again to one of our live Q&A sessions where we answer some of the questions that you've submitted this week on our videos, as well as any questions that come into us live during question and answer session. Remember, we are putting out videos every week. So please make sure you subscribe to the channel and make sure you like all of our videos because it really helps us out. And let us know what topics you want to hear more about. And if you want to get notified when a new video comes out, make sure you hit that notification button. We're also on Facebook, Instagram, and Twitter. So please feel free to follow us there for additional information. And I just want to let you know we really appreciate everything that you guys have been doing. And without any further ado, I'm going to get right into the questions. Remember, if you have a question, please feel free to type it into the chat for us. So tonight, I'm going to actually start with a question on colic. This was a question that was submitted to us from a grandmother. And she says that my granddaughter is almost 3 and still has crying fits. Could this be colic or possibly something else? And how long will colic last? So this was an excellent question that was submitted. Colic is basically a condition that usually happens between 6 weeks and 16 weeks of age. And what happens with colic is basically kind of around dinner time, your baby's going to get very, very fussy, usually for a couple hours. Colic is usually kind of identified by a baby who's crying. There's some gassiness, maybe some spitting up. A lot of times we associate colic with formula feeding, but I'm going to let you know that that's not how you really should look at it. Colic seems to be common amongst both breastfeeding and formula feeding babies. For breastfed babies, it often has to do with something that they're sensitive to. Now, there's a lot of research about colic because while we associate it with like a feeding issue, there's some evidence that links it to actually just irritability and basically feeling overwhelmed. If you think about it, up until 6 weeks of age, your baby is sleeping most of the time. They're not really interacting with their environment that much because they're still actually recovering from birth and continuing to grow and develop a little bit. But at about 6 weeks of age, your baby starts to wake up. And in that waking up, they start to notice and interact with the world around them. And everything is brand new to them. Every single sight, every single sound, every single smell, every texture, everything. Imagine if from the time you wake up until 3, 4 o'clock in the afternoon, every single thing you're experiencing while awake is new. This would be overwhelming stimuli for any human being, and for our babies especially so. And so the thought process, and there's some studies going on, is that babies may actually be suffering from headaches instead of a stomach issue, and that headache is what's causing the colic. Now, if your baby has a headache, unlike us, your baby can't say to you, hey, I need a Tylenol. So unfortunately, all they can do is cry. And this is why a lot of parents will report that they can't seem to console their babies, which leads us away from that gastrointestinal or stomach issue. Now, let's say it is a stomach issue. So stomach issues are often associated with poor balance of the microbiome. That's the gut flora that helps keep us healthy. One of the ways you can counteract that is to offer your baby a probiotic. And you can ask your pediatrician which probiotic they prefer. For formula-fed babies, you may need to try a more sensitive formula. Sensitive formulas are broken down formulas that are easier to digest. And we have a link we have a video on formula feeding, and we'll link that into the chat. Now, for breastfed babies, it may be a food sensitivity, something that you're eating that's causing your baby to feel an upset tummy. Big culprits for breastfeeding moms are dairy, chocolate, caffeine. So you want to make sure that you're looking at your diet and possibly eliminating something that's causing that. Now, again, colic should end around 16 weeks of age. So if you're having a baby that's experiencing this after 16 weeks of age, you want to let your pediatrician know. Additionally, if it happens before 6 weeks of age, you want to let the pediatrician know because this is really outside the normal range of colic. Now, this grandmother said that her granddaughter was 3. So one of the things that I would say is if it's 3 weeks, you need to contact your pediatrician. If it's 3 months, it is probably considered normal and will hopefully go away soon. And if it is 3 years old, you again need to contact your pediatrician. Colic is self-limiting. Okay, it is a very difficult time for parents because the baby is very challenging to deal with. It's hard for anybody to listen to a baby cry for hours on end. If you're feeling stressed, if it's difficult for you to be able to manage this, make sure that you walk away from the baby if it's too much. You put your baby into a secure location like their crib, and you go ahead and you take a break for a minute. Okay, this does not mean leaving the house and, going to the store. This simply means that it is okay if you put your baby into a safe spot and maybe you go outside and breathe a couple deep breaths of fresh air or drink a cup of coffee. Your baby will be okay. And if this is the break you need to avoid further frustration, it's very important. So that was a really good question about colic. Our next question is about growth. So on my 28-week growth scan, my doctor mentioned my baby is on the 20th percentile. What should I eat or how should I eat to increase the baby's weight? I reached 29 weeks with my firstborn, which was 6.2 pounds at the time of birth. So this was a very interesting question, and I felt like it was a really good question for us to address. So first thing is, I'm actually going to respond to this viewer's comment about her 29-week baby being 6.2 pounds. 6.2 pounds at 29 weeks is considered a very large baby. That's actually over large. And there's very few reasons for that to happen. And the most common reason is related to gestational diabetes. And we have a video on that, so we'll link that into the description. But with gestational diabetes, a baby gets exposed to too much sugar, and therefore that sugar increases their weight. And that's not a good thing, because what happens is when the baby's born, the baby is not exposed to that much sugar and their sugar crashes, and they usually need IV fluids and intensive care treatment in order to regulate. So it should be noted that that's not considered a normal weight for that gestational age. Now, a 20 percentile weight baby is not necessarily a bad thing. If your baby remains 20% throughout and otherwise is healthy, then your baby just may be small. If your baby is, say, the 50th percentile and drops to the 20th percentile, that's considered a warning sign. And usually that's indicative of the placenta, which is the organ that feeds your baby, not working as well. So, is there anything you can eat? No, not really. What can you do to increase your baby's size? Good health. Okay, so you need to be drinking right and eating right yourself. Lots of whole foods, a low sugar diet, exercise if you're allowed to. You want to maintain good health and avoid high blood pressure and diabetes. This is the best chance of maintaining good placenta function. And remember, your placenta is the organ that feeds your baby through the umbilical cord. And that is the best chance of increasing your baby's weight. So that was a really, really good question. All right. I see we have a question in the chat. Hello, Karthika. So this is a really good question. Shall I breastfeed my baby? So what I'm going to tell you is the evidence shows that breastfeeding is extremely beneficial for our babies. When you breastfeed, you pass along antibodies for different diseases and illnesses that you get exposed to. So if you get exposed to the cold, you'll develop antibodies and you pass those through to your baby in the breast milk, which helps protect your baby from getting sick. Additionally, when you breastfeed your baby, that helps that put them at a lower risk for developing diabetes and hypertension or high blood pressure, as well as obesity when they are an adult. For you, it helps reduce your risk of cancer as you get older. So breastfeeding has a lot of amazing benefits. And of course, breast milk is free, so you don't have to purchase any bottles or any formula, anything like that. It's readily available. You can just go ahead and breastfeed whenever you want to without having any issues. However, if you decide to formula feed, that's okay also, because formula feeding is another healthy way to feed your baby. Yes, there are different advantages and disadvantages to formula feeding, but in the end, the most important thing is a healthy mom and a healthy baby. Great question. Thank you so much for asking it. All right, so we have a couple questions about labor. A lot of people like to know what to expect when they're going into labor, and are some of the symptoms that they're experiencing signs of labor. So I had three different kind of questions and comments. So the first one is, I'm 39 weeks pregnant, my back hurts, and I feel lightning pain in my vagina. The second one is, my EDD is tomorrow. I feel my stomach tighten and loosen often, and back pain too. Am I getting into labor? And the third comment was, I'm 35 weeks and 2 days with my first pregnancy. All day today, throughout the day, I felt hardening and tightening on my upper bump area. The past 3 hours, I felt lower back pains where the pains go down to the back of my legs and towards my kneecaps. I have not lost my mucus plug yet. Any ideas? So these three comments highlight a lot of good things to talk about with labor. So labor is the tightening and the most common symptom of labor, I should say, is the tightening and relaxing of the belly. What you're actually feeling is the uterus contracting. So the uterus, it contracts, it tightens for two reasons. First of all, it tightens to push baby down. And then as it relaxes, it pulls the cervix apart. And the idea behind this is the cervix is the opening to the vagina, and it needs to open up to allow baby's head to pass down through the vagina for delivery. So a tightening and relaxing sensation that comes and goes is considered contractions. Now, true labor contractions, they happen at a regular interval. They happen for a certain amount of time, and they get closer and closer together. So a certain amount of time, it's like a minute to 2 minutes long. So when you're having that tightening, it's tight for a minute. Okay. And the pattern is very much the same. So at the beginning of labor, you might have a contraction that lasts for 1 minute every 15 minutes. And then it'll be every 12 minutes and then 8 minutes. It depends on you, but they happen very regimented, and they always last for usually about 30 to 90 seconds. And if you get into a regular pattern like that, then that is something that is considered a sign of labor. Now, back pain is considered another sign of labor. A lot of times women will experience back pain because of the position of the baby's head, and that the baby's head is kind of hitting the spine. Back labor can be challenging and often requires different labor positions to help ease that pain. Lightning pain, or like a electric pain in the vagina, that can be a nerve that's being hit by the baby pressing down as the contractions happen. Some women will report that they have like cramping pain, like a period. Now, you do not have to lose your mucus plug to be in labor. So you have your uterus, and at the bottom of your uterus is your cervix, okay? And the cervix is closed, but there's always an opening because it's got to open up for the baby. So there's often some mucus in here, and we call it the mucus plug because it kind of sits there and plugs it up so that no bacteria can rise into the uterus and cause an infection. As the cervix opens, a lot of times women will get this piece of tissue that comes out, and that's considered losing the mucus plug. But that doesn't happen to everybody. And sometimes the tissue is something else. So if you ever think you're losing your mucus plug, you want to let your healthcare provider know what you saw so they can decide and evaluate. As far as losing the mucus plug, some women just don't have this big chunk of tissue that comes out. And instead, it's just a little bit of like lubrication or mucus that they wipe away as they're going to the bathroom. So you can't plan on a mucus plug being an indication that you're in true labor. If you're 35 weeks and having regular contractions, you need to call your healthcare provider because they're going to want to evaluate you. One of the most common causes of preterm labor is dehydration. So a lot of times if you go into the hospital, we'll actually start an IV, we'll give you a couple bags of IV fluid and that'll stop everything. And of course, a 35-week baby isn't ready to be born yet. Babies are considered premature up until 39 weeks. So that's a great question. And, it's something that you definitely want to talk with your healthcare provider if you're not sure if you're having symptoms. All right, Karthika, I see. So you gave birth 2 weeks back. After 7 days, you got Bell's palsy. You're taking steroid shots. And now okay. So you're taking the steroids and then it's making your blood sugar high. So should you feed the baby? So Bell's palsy is a condition that some women will develop spontaneously and it usually resolves. It has to do with nerve in the face. And it's usually something that most women will recover from. Because it's an inflammation of a nerve, most women receive steroids. Steroids are a type of medication that can help to reduce inflammation. But one of the side effects of steroids can be increased blood sugar, and you can also have insomnia, which is very challenging when you have a 2-week-old. Now, as far as the sugar, it's okay to breastfeed the baby. Your baby is now only getting sugar through the milk. And the biggest thing that'll happen for a baby who gets too much sugar in the milk is that the baby may end up with like a frothy kind of greenish poop. They may also have a little bit more gas and discomfort because that high sugar content, it upsets their stomach a little bit. One of the things you can do to counteract that is you can actually go ahead and pump off a little bit of the milk, like the first minute of milk, and then start breastfeeding, because the milk that's towards the end of your feeding is actually higher in fat and protein, and it counteracts a high sugar content. So while we don't like a lot of sugar when you're pregnant, once you're breastfeeding, it's okay. You just look out for that stomach upset. The bigger thing that I'm worried about is the steroids. So I'm just looking in my drug guide. So any practitioner who's giving you advice on medications while you are breastfeeding or pregnant should be looking at a guide that's specialized for pregnant women. I am going to use a generic steroid that I am familiar with that's often used with pregnant women, which is prednisone. And I want to make sure. Now, for you, Karthika, I hope I'm saying your name right. I cannot officially advise you because I don't know the name of the steroid medication. However, generally speaking, low doses for short periods of time are safe for breastfeeding. Now, what can you do, Karthika, to make sure that it's okay? Review the medication with your pediatrician and make sure the pediatrician knows what you're taking and that they're okay with the baby receiving some. And also check with your local pharmacist who can also verify if this is safe for breastfeeding women. So when you're breastfeeding, not 100% of the medication gets into your breast milk. In fact, usually very small amounts get into the breast milk. And if it's not a fat soluble medication, even less is going to get in. So a lot of times there's a lot of medications that we can take and still safely breastfeed our babies. If for some reason you're told that you cannot take that medication and breastfeed, you can pump and dump for the amount of time that you're taking the medication and then resume breastfeeding. Thank you, Karthika. I am going to look that one up, which I believe is also okay. And again, if you are not sure about a medication that you have been prescribed for yourself while you're breastfeeding or pregnant, you can ask your healthcare provider or your local pharmacist. Okay. So, long-term use of that medication could be a problem for a baby, but long-term use is considered months. a 10-day course should be safe. Again, I would double check with your pediatrician to make sure there is nothing that they object to with that, but a short-term course of that medication should be okay for your baby. Now, one of the things you should know, and this is why it's so important to check, if Karthika had told me she was pregnant, this would absolutely be contraindicated during pregnancy because it can cause birth defects. This is why it's so important to get this stuff checked out. Thank you so much for asking that. I really appreciate it. That was a good question. All right, so we have a question about pelvic pain. I'm 28 weeks pregnant and I feel discomfort and pain always and everywhere. So, pelvic pain is something a lot of pregnant women experience. And there's a couple different types of pelvic pain that you need to be aware of. So, for one, you may start to feel an aching at the hip bones. That aching is caused by the hormone relaxin that relaxes those joints and it causes everything to kind of loosen. Your hips have to be able to separate when you go ahead and give birth. So, as a result, as that relaxes and the baby settles in, that extra pressure and weight can cause a little bit of discomfort. Some women will experience a sharp stabbing pain, kind of towards where the outside of their abdomen, where their ovaries are. This sharp stabbing pain is usually round ligament pain. So, your uterus is this kind of like pouch like organ, and it kind of floats inside your abdomen, but it can't really float there because it would just flop over. So, it's connected by these kind of string like things called ligaments. And during your pregnancy, as the uterus gets bigger and the baby gets bigger, there's a lot of weight there, and those ligaments get stretched. And sometimes the baby will move or you will move, and that will cause this sharp, sudden pain. And that's usually round ligament pain. While both of these types of pains are considered normal, you want to make sure you always let your healthcare provider know, because a cramping pain, for example, or a lower back pain that comes and goes could be a sign of preterm labor, and that's a serious thing that needs to be investigated. You're welcome so much, Karthika. I hope I'm saying that right. I have no problem. Thank you so much for asking. All right, and if you're just joining us, we're here for our live Q&A session. Please feel free to put any questions you have into the chat, and we will try to answer them live for you. So we got a question on our drying up breast milk video, and it said, ma'am, I'm producing too much breast milk. My baby is 2 months old, and he is not sucking out all the milk. When he sucks too much milk, he coughs continuously. What can I do? So this is a great question, and this is actually a sign of oversupply. So for some women, they make way more breast milk than they need, and they have a very strong letdown. And what happens is the baby will end up gulping and choking, and the baby can end up with a lot of gas, a lot of irritability because their stomach is so upset. So there's a couple things that you can do to help this. The first and easiest thing to do is to go ahead and stimulate your breast right before you start breastfeeding and basically wait for the letdown to happen. That's that first bit of milk that just kind of rushes out, and collect that milk separately. And then once that fast flow stops, then put your baby on. For a lot of women, their letdown when they have overproduction will yield 2 ounces of milk in like a minute. So that's a lot of milk for a baby to gulp down in a minute. And that's a really good way for you to help ease the feeding for the baby, to help empty your breast better, and to help build like a collection of breast milk. The next thing you can do is you can go ahead and you can breastfeed kind of laying back on your back. So when you breastfeed laying flat on your back and you put your baby on top of you, what happens is gravity allows the milk to kind of flow to the side on your breast. So even though you may have a forceful ejection, your baby is not going to be able to gulp all of that down because they're going to be kind of lying on top. So a lot of milk will spill out. Now that's a very messy way to handle it, but it is a legitimate strategy for dealing with this oversupply. Now, regulating the feedings is also a very good thing. So what do I mean by that? A lot of women will do 10 minutes and 10 minutes or 15 minutes and 15 minutes for every breastfeeding session. Instead, what I would encourage you to do is to breastfeed on one side for the full amount of time. So if your baby normally eats for 30 minutes, one side for 30 minutes. And then in 2 to 3 hours when the baby's ready to eat, only this side for 30 minutes. The idea behind this is every 6 hours you're feeding off of a breast, right? So you're actually telling your body, I need a little bit less milk right now because I'm not going to feed on this breast every 3 hours. And that can go ahead and help to regulate your supply. Now, I would hesitate to tell you if you want to continue to breastfeed, you probably don't want to use some of the traditional methods to dry up milk. Because if you use cabbage leaves or peppermint or ice, that can dry up your milk really, really fast. And you might end up, having an undersupply. So part of the other trick of this is the age of this baby. This baby is 2 months old. So babies up until 12 weeks, a lot of times your milk supply is still regulating. So you want to be very careful about trying to limit. If you do produce a lot, but you're worried about getting plugged ducts or mastitis because the baby's not emptying everything completely, I would encourage you to collect all the milk and possibly donate that milk to a milk bank. And we actually have a video on donating milk, and we'll put that link for that in the description. But donating your breast milk will actually go to babies who are medically fragile and use breast milk as a form of medication. So this is also a really nice way to maintain your milk supply while your baby regulates based off of their nutritional needs, and extra goes to a baby that might need it for medication. If you're really desperate and you're getting a lot of plug ducts, maybe using a little bit of cabbage leaves, cold cabbage leaves on the breasts 1 or 2 times a day may help to regulate that down. But you want to be very, very careful with that. So that's a really good question. For those of you who are joining us, hi, I'm Dr. Samantha, the maternity mentor. Thank you so much for joining us again for our live Q&A session. We're here every Monday at 9 p.m. Eastern Standard Time, answering your questions that you've submitted into our videos. We're also here to answer any questions that you might have live. So feel free to put questions into the chat and we'll try to get to them. Hi, Phoenix. Welcome, welcome. So our next question has to do with sexually transmitted diseases. So I had sexually transmitted infection symptoms during my first trimester. I didn't treat them. And now I'm in my second trimester and the symptoms are gone. Should I be concerned? So some of the symptoms of sexually transmitted diseases include discharge that's colored. It can be gray, white, green, yellow. Oftentimes there's a smell that's associated. You might have itching or pain, okay? Sexually transmitted diseases need to be tested for to determine what it is and how to treat it. So usually, since we have a lot of discharge, what we'll do is we'll go ahead and swab a woman using our cotton tip, a sterile cotton tip applicator, send it to a lab, test it, and then we treat. Now, if you were diagnosed with a sexually transmitted disease and didn't treat it, that can be an issue, and we'll get back to that. However, sometimes the early symptoms of pregnancy may mimic a sexually transmitted disease, and you may not actually have one. So some of the hormones related to sustaining a healthy pregnancy thin out the vaginal tissue, and that can cause itching and even burning. There is a normal amount of discharge that happens during your first trimester of pregnancy, often to prevent bacteria going up into the uterus, which could cause an infection. So if you have symptoms, you want to get checked out so they can figure out if your symptoms are normal or not normal. Now, if you had a sexually transmitted disease that you did not treat and you were definitively diagnosed, I would encourage you to treat that now. You need to get retested and get treated. Most of the tests, most of the infections are treated with antibiotics. It's very quick. It's very simple. There are certain sexually transmitted diseases that, if left untreated, can cause serious issues for your baby. If you have active herpes lesions when you deliver, this can actually transmit to your baby, and babies have been known to die within a week or 2 of birth if they develop the herpes simplex virus. For moms who have chlamydia, If it's left untreated and you have an active infection during birth, your baby can actually end up going blind. So one of the things that we do to try to prevent this is we give the antibiotic ointment. So for any of you who wondered why a baby gets that ointment, it's just in case a woman has been exposed to chlamydia prior to birth. It's to prevent blindness in the baby. Now, one of the most serious sexually transmitted diseases that I was concerned about with this question was syphilis. So, syphilis is a very, very interesting sexually transmitted disease. And one of the things that happens is oftentimes in the beginning, it's asymptomatic or the symptoms are very mild. But then it can go into a dormant state. And during that dormant state, there are no symptoms whatsoever. If left untreated, syphilis will go into a final stage, which can cause a variety of serious consequences, including brain damage and death. So, if you were definitively diagnosed with syphilis and you did not receive treatment, you need to receive treatment now. If you're unsure if syphilis was the cause of those symptoms, you need to go get checked out because syphilis is easily treated with penicillin. Super simple, easy to do, very quick to be done with. So make sure that you're receiving treatment if you know you had some kind of disease, okay? Now, every week we get lots of questions about bleeding. So I've got a couple different ones and I'm going to read them all together because they are very much related. So the first question or comment was, I'm 7 weeks pregnant and I've been bleeding since 4 days, but the bleeding is very light and I have back pain. The second question is, I'm 6 months pregnant and I have sharp pain in my lower abdomen and vaginal discharge with bleeding. Should I worry? And the third question was, I had implantation cramps around 5 to 7 days after I ovulated, then light, clotless, bright red bleeding at day 14. Also, this bleeding had soft, mild cramps, not like period cramps, and lower back pain like stretching. The bleeding wasn't as light as spotting, but not as heavy as a period. I'm curious if other people experience this. So there's a lot of good information in these. So let's start with bleeding in general. If you have any bleeding during your pregnancy, you need to contact your healthcare provider. Bleeding is not normal unless you are in active labor being monitored by a healthcare provider who's telling you the bleeding they see is normal. Other than that, your healthcare provider needs to be made aware. So what does bleeding look like? It can be pink. It can be dark pink. It can be light red. It can be dark red. It can be bright red. It can be dark red. I'm sorry, I said that. Or it can be brown. Brown is old blood. Pink is like a light spotting. And red, bright red especially, is usually active bleeding. So a lot of people will think if I see old blood or spotting, it might not be a big deal, but it depends on what caused it. So it can be very normal in your first trimester to bleed a little bit. So we have the one mom who said implantation cramps. So implantation cramps and bleeding happen when the fertilized egg implants into the side of the uterus. This is a time where some spotting may be noticed. It doesn't happen for all women, but it does happen for some women. So that bleeding is usually spotting. There's usually no clots, which are pieces of blood, and it usually goes away very quickly. But since you don't know for sure that that's implantation bleeding, you still want to let your healthcare provider know because there are other causes of that. For our 7-week pregnant mom, she's having bleeding for 4 days. It's light, but she has back pain. Well, the back pain could be some cramping because unfortunately she may be having a miscarriage. Now, some of the other causes of bleeding can be a subchorionic hemorrhage. And we have a video on that and we'll link that in the description. But basically a subchorionic hemorrhage is like a pocket of blood kind of underneath the placenta that develops. A lot of times it clots off. You can have a safe pregnancy, but sometimes some of that bleeding will ooze out underneath and that's what you see. Okay. Now, when you're further along in your pregnancy, so the mom who's 6 months pregnant, having a sharp pain in the lower abdomen with vaginal bleeding, this is what I would consider a medical emergency. You need to reach your healthcare provider immediately. If you cannot reach them, you need to go to the closest hospital. So The placenta is the organ that feeds your baby. So this is your uterine wall and your placenta attaches. And there's a whole bunch of blood vessels that go in between the uterine wall and the placenta. And the placenta is then attached to your baby through the umbilical cord, which goes through the belly button. And the placenta's job is to give your baby nutrients and oxygen and to take away the toxins that your baby doesn't need, because your baby can't process those. You process all of that for your baby. Now, that placenta has to stay attached to the uterine wall. If it starts to come away, remember, this is all blood vessels. And if this comes away, this can cause life-threatening bleeding for both you and for your baby. So we need to make sure that this stays attached at all times. When this comes away, that's called a placental abruption. And we have a video on that. We'll link that in the description. But a placental abruption is a medical emergency that needs to be dealt with quickly, or both mom and baby can die. One of the symptoms of a placental abruption is sharp stabbing pain. So if you have sharp pain in your belly with bleeding, you need to call your provider or go to an emergency room. In the emergency room, they're going to perform an ultrasound to determine the cause of that bleeding. Now, could it be that you have a little subchorionic hemorrhage and it just so happens you also have round ligament pain, which is pelvic pain that can be considered normal? Absolutely. And maybe that bleeding is nothing, but you can't take the chance that it is something. Now, other causes of bleeding during pregnancy that can be considered normal, a big one is sex. So the hormones that are needed in order to maintain a healthy pregnancy, they thin out the vaginal tissue and they dry it up. They also kind of dry up some of your natural secretions. And as a result, sex can cause bleeding. So one of the things I tell my moms is make sure you're using lots of lubrication when you are having sex, because this can help to reduce the risk of that. And we actually have a video on sex during pregnancy, so we'll link that for you. So that's a really good question. For any of you guys who are joining us, welcome. Thank you so much for being here. If you have any questions that you want answered live, please feel free to put them in the chat. That's what we're here for. So I have a question from, I believe, a dad who says, my wife is 7 months pregnant. What can she use to treat a yeast infection? So ultimately, yeast infection, you have to go through your healthcare provider for their final guidance, because it depends on a couple different things. Generally speaking, all of the medications that you find over the counter for yeast infections are safe and they are effective for yeast infection during pregnancy. The thing is, with these yeast infection treatments, there's different versions. So for example, there's creams, there's ointments, there's these little suppositories, which look like a big giant capsule that you have to stick up into the vagina. Some of the treatments are 2 days, some of them are 5 days, some of them are 7 days. So that your healthcare provider may have a preference as to a specific brand or method that they prefer for their patients, which is why I encourage you to ask your healthcare provider. Now, additionally, some infections are resistant and need a stronger medication, like a pill, like an oral medication. So this is another reason to contact your healthcare provider, because they may choose to give you the oral medication versus having you use a vaginal medication. Because if you are having any kind of complications that put you at high risk for infection, they may not want you inserting anything into the vagina. Now, additionally, how do you know it's a yeast infection? So women have a tendency to get yeast infections, and the symptoms are pretty standard. It's usually itching and burning and this like kind of thick white cottage cheese type discharge. But you are pregnant, which means you cannot take for granted that you know what you have. So you want to make sure that your healthcare provider takes one of those samples I was talking about earlier, where they take the little sample using the sterile Q-tip, they send it to a lab to get tested. Because if it's not a yeast infection, those yeast treatments won't help. And if it's another infection, delaying treatment may actually make it worse. Moving right along. So we have a question about clogged ducts. So I'm a breastfeeding mom and I have a clogged milk duct for more than 2 months and it's not dissolving. And now my breasts are itching and in pain. What should I do? Okay. So clogged ducts are very frustrating. Basically, underneath your breast, you have a whole bunch of little tiny balloon-like sacs that when you are making milk, fill up with milk. So they go from flat to this round thing. So that's why they feel like a pea underneath your breast, okay? And when it gets full, there's a little tube that allows the milk to come out, and it flattens again until you make more milk. So it goes out and in and out and in, right? Now, if this little opening right here gets clogged, the milk just sits there. And eventually that milk can actually cause an infection called mastitis, which can be very serious and may require you to receive some antibiotic treatment from your healthcare provider. So it's very important for us to deal with clogged ducts. Some of the ways that we deal with that is massage, extra pumping or breastfeeding on that side. You can use warm compresses, and you can have your baby eat more on that side, okay? Sometimes a little bit of ice can also help. For moms who get repeated clogged ducts, you can actually use lecithin, which is an over-the-counter supplement that helps to reduce your risk and prevent these clogged ducts because it kind of thins stuff out a little bit. But 2 months of a clogged duct is no longer something that you can deal with on your own. If you are having a lump in your breast for that amount of time, you need to go see your OBGYN for further examination. So pregnancy is a time where you have a lot of hormones running through your body. And there are certain types of breast cancer that become activated during pregnancy, postpartum, and breastfeeding. This is because the hormones that sustain your pregnancy and breast milk production also feed certain types of female breast cancers. So if you have a prolonged lump in your breast, you may think it's a clogged duct and it really isn't. You're probably going to need to get a mammogram and maybe an ultrasound to look at that area and determine if there is actually milk in there or not. If it is truly a clogged duct, they may need to go in with a little needle and aspirate that area. That means they pull out using like a needle and a syringe the milk that's there to try to clear up that clogged duct. Of course, if you have any symptoms of infection, they are probably going to give you some antibiotics as well. But again, clogged ducts usually present themselves and resolve in a couple days, or you develop mastitis, and mastitis is something you can't ignore for 2 months. So I want you please to go get looked at by your healthcare provider. For any of you who are still with us, we're here for our live Q&A session. Please feel free to put any questions you have in the chat. Our next question is about an incompetent cervix. So I am 33 weeks pregnant and my cervical length is 2.56. Is this a problem? So let's talk about this. So you have a uterus, okay? And at the bottom of your uterus is the opening to your vagina. And this is the cervix. This is that connection from the uterus to the vagina. A cervix is supposed to be long, thick, and closed. Okay, this is what an open cervix would look like. And your cervix opens or dilates when you are in labor to allow your baby's head to come down. Okay, so when we're talking about cervical length, depending on how far along in your pregnancy you are, depends on the length. And this is measured in centimeters. Okay, so a normal length of a cervix from 24 to 28 weeks is 3.5 to 4 centimeters. And so at 33 weeks, it should be only a little tiny bit less than this at most. So that cervical length could be concerning. Now, what could be causing that cervix to be shorter? So first of all, some women anatomically have a shorter cervix. That's just them. So if you've had multiple healthy pregnancies, this pregnancy is healthy, you're having no symptoms, I wouldn't just assume that there's an issue because it's a shorter cervical length. However, cervical length can also be shortened by contractions. So as you have your contractions, right? Your uterus is pulling on this cervix, and as it pulls, it opens that up, okay? And as it opens it up, the cervix kind of thins out like this and goes away so that your baby can come down. So it actually looks like this and goes like that, okay? So in that process, the cervix is shortening as it starts to thin out. So if your cervix has been getting shorter and is shorter than we expect it to be at your gestational age, that could be a sign of preterm labor. Now, what do you do about it? Unless your healthcare provider has told you to do anything or diagnosed you as something, you're probably not going to do anything. A woman who has a short cervix at, say, 12 weeks of pregnancy is much more likely to have some interventions done, like a cerclage, which is a stitch that we put into the cervix, or to have bed rest or other things. At 33 weeks of pregnancy, your healthcare provider probably wants you to be moving around and stuff like that to prevent other complications that could arise. So the best thing to do is to eat right, to rest, to drink lots of fluids, and to take it easy. Okay. So taking it easy can simply mean no heavy lifting, don't stand on your feet for too long, stuff like that. You want to be sure that you're resting. If you're tired, you rest because your body's telling you to rest. But bed rest is not always the best thing, and don't just start doing bed rest unless your healthcare provider has told you to do so. The other question a lot of women have when they have a short cervix is, can I have sex? So unless your healthcare provider has told you otherwise, sex is healthy for the entire amount of your pregnancy. A short cervix does not necessarily mean that you can't have sex with your partner if you want to. All right. So we're wrapping up tonight. I have one last question for tonight, and then we're, going to be done. So for those of you who are joining us, welcome, welcome. This is our live Q&A session. Please feel free to put any questions you have into the chat. That's what we're here for, to answer your questions, both some that you've submitted on the videos as well as live questions. So the last question from our videos is, ma'am, I'm now 6.5 months post having my baby. So the baby's 6.5 months old and I got pregnant again. Can I breastfeed my baby now? And will my new baby have any effects from breastfeeding? So this is a fantastic question. So when you are pregnant, you can breastfeed with some exceptions, okay? So what happens is breastfeeding, the milk ejection hormone is oxytocin. And oxytocin is the same hormone that causes you to have contractions. So one of the biggest reasons why you can't breastfeed while you are pregnant is if you are experiencing contractions. And your healthcare provider can let you know if they are concerned about that. Now, one of the other things that happens in a normal pregnancy is around 6 months during your pregnancy, your milk may actually start to dry up, and it may actually turn back into colostrum. So colostrum is that very thin, small, high sugar, high fat first milk that our newborns need when they first come out of the belly. Now, the thing with colostrum is it's a very small amount. So for some women, what's going to happen is the breast milk is going to dry up just to this little colostrum amount. If that happens, your 6.5-month-old baby is not going to grow as well anymore. So you need to be mindful that if you do continue to breastfeed, you want to make sure that the baby that you are breastfeeding is growing well. The baby is having the right number of pees, the right number of poops, that the baby is acting like normal, like the baby has energy, the baby is not sleeping too much. If you have any concerns, or if you don't feel that your breast milk supply is there anymore, you need to supplement with formula. However, many women can go on to breastfeed both an older baby and a newborn. If you are able to breastfeed throughout your entire pregnancy, you need to make sure that when you deliver your newborn, the newborn baby gets fed first. The newborn is the priority. And your older baby, who should be able to drink formula and eat regular foods, is the secondary to that, because the newborn could have very serious consequences if they do not receive enough milk. You also need to teach your older child that the baby comes first. It's a very good lesson for them to understand that they need to allow their little brother or sister to eat well. Now, again, you can breastfeed, and the WHO confirms this, while you are pregnant, but you need to monitor it carefully. If you have any symptoms at all of preterm labor, or if your healthcare provider says you're a high-risk pregnancy and you should not breastfeed while pregnant, you need to stop immediately, okay? There is a small risk of miscarriage that can be associated, but this is a very rare thing. So that comes to the end of all of the questions that have been submitted to us over the last week from our viewers on the videos. For those of you who might be joining us right now, we're almost done. So please feel free, if you have any questions, to pop them into the chat. My name is Dr. Samantha. I'm the maternity mentor. Thank you so much for being a part of our community. Please remember to subscribe to the channel, like our videos, and hit the notification bell so you can get notified when we submit new content. We're trying to put out videos all the time. We have this live Q&A session on Mondays at 9 p.m. Eastern Standard Time, where we take the time to answer any questions that you've submitted on our videos, as well as any questions that you give to us live here in our chat. So please feel free to make sure you put anything in the chat. Remember to share our channel with your friends and family. Follow us on Facebook, Instagram, and Twitter for additional content. And, we just really appreciate you guys and everything that you've been doing to support us. And we hope we're supporting you as well. So I don't see anything coming into the chat. If we didn't get a chance to answer your question, please feel free to submit that on one of the videos. Without further ado, my name is Dr. Samantha. I'm the maternity mentor. And we look forward to talking with you again. Bye.